Shannon, I know I've been able to do it in chat that is not this type of session. I'm not seeing the option right here, but I know at the February meeting, we certainly had people posting some things. So Kathy, if the meeting gets started, will you start the recording while I do a little bit of quick research to ascertain how I can add Shannon's document to chat? Okay, sounds like Kathy wasn't able to hear me, so I'm going to step away.
I'm sorry, I forgot to unmute myself.
Oh,
sorry about that. Yes,
okay,
I can start the recording. And would we be sharing the alternate Appendix A then?
Yes. Well,
okay.
We can share it on screen if Shannon's not able to do so, but I'm also trying to upload the document to chat.
Okay.
Yeah,
So,
I'll definitely share it. Oh, look,
okay.
Anna did it. Thank you, Anna.
Oh, thank you, Anna.
Yep. Yeah, I'll definitely be able to share it. Thank you.
All right, this is Ross. Looks like we've got a quorum here. Amber's not going to be able to make it today. The only board member that we're waiting for that is scheduled to make it is Dr. Stanger, but we do have 5 board members right now, so we do have a quorum. So we're going to go. I'm going to go ahead and convene the Board of Health meeting. Just a notice and chime in, Julie, if you want to add in anything here, just in terms of logistics and technology. We're going to ask people that are not speaking or just attending at a given point to both turn off their camera and to turn off their speakers or microphones so that it doesn't chew up too much bandwidth. We do end up with some technology problems if there's too many microphones turned on and too many cameras turned on at any one time. If you are speaking, go ahead and turn those devices on, of course. So with that, we will convene as the Board of Health, and we will start out with I guess I'm going to ask a question. My understanding is that Adrian Beck had basically a family emergency, and that she was going to have somebody sitting in, I believe, by the name of Ken. Ken, are you on the meeting and ready to step in for Adrian, or should I move to another agenda item?
No, I'm here, sir, if you're ready for my report.
Okay, so Ken, if you could take item number 1 and run with it. It's our COVID-19 vaccination update. And Ken, if you could just state your full name for the record and what your position is, that'd be great, Ken.
My name is Ken Parks. I'm the Deputy Director to Adrian Beck under the Office of Emergency Management. Right now I'm serving as the Incident Commander for the Vaccine Coordination Team that's currently operating in Missoula County. So a quick update from what we've been doing over here. We continue to see basically the same supply come from the state, right around 2,900, 2 trays of Pfizer and a smattering of Moderna. So that's kind of been the usual that we've been getting, and that seems to be staying about the same. What we have seen an increase in is in the federal allocations coming into pharmacies and into PHC, which has really made a difference in our county up to this point. We're seeing quite a few more people getting shots in. I believe last week we had 8,300 total shots given in Missoula County. That's first and second doses. And it just continues to go up. The week before that, it was at about 7,300. So we continue to see a steady increase, and it's kind of due to that federal allotment that's coming into our county at this time. We do have a little bit of difficulty in coordinating some of that as that it comes on a different supply schedule, and it kind of comes to the pharmacies in not necessarily regular allotments. So we're kind of struggling slightly in trying to pin down that number that comes into our county every week, and we really don't know until we look at IMTRACs at the end of the week. So that's been interesting, but it's all going very well. The shots are getting in arms, and many of these pharmacies are very well organized and are working well with the teachers and the daycare providers. What we've seen very good progress through that teacher tier that the federal allocation to the pharmacies was initially intended for, and we're right now we're looking into how much of those federally designated daycares have been reached, and what kind of outreach we need to do to get them into the queue and finished up here shortly. So that's some of our efforts here. We're looking at we're in phase 1B plus until the end of March. We're trying to get as many people in there as possible out of that phase, but we are seeing quite a slowdown in our public sign-up process. We are needing to do a little bit more public outreach and kind of turning over a few more rocks to fill those clinics up. So that's kind of we got a couple more weeks to go, and I think we'll have to monitor that situation closely to see, if we do start to see a real lag. Reaching out to the state and asking if we can start to do something slightly different if we're having difficulty getting our clinics filled up. But we're not there yet. And we do have a good meeting today with the health department and some other folks to talk about kind of what was phase C and which is now gone, but still trying to maintain some focus on some of those people out there, your food and beverage workers, and people that will either provide a bit of safety and kind of slow the spread kind of focus, and then also looking at utilities, wildland firefighters, and local government to see how we can also provide protection to our infrastructure and people that need to go out there and perform critical duties. So that's kind of our approach this week. On April 1st, as I think everybody's aware, we go to general population, which should be very interesting to see if what kind of uptake we get then, and hopefully by then we've seen an increase in our vaccine supply. The health department's organization out at Lucky's, their mass clinics out there have a large capacity, and we're going to be leaning on them quite heavily here moving forward. We've kind of had this teeter-totter approach, and the university is coming out of their first dose phase that they were in, and they're going to be moving our focus over to Lucky's. And it sounds like community is going to do some more shots, but then they're going to be pretty much looking to get out of the game, and we'll be talking to Providence to see what their kind of schedule is here going forward. But really, it looks like some of the main players we're going to have after we go into April 1st is really going to be Lucky's, PHC, and maybe a smattering of other clinics. So, but we're very optimistic that we're going to be able to meet that supply and demand. And we have, so we're also looking at the homebound population and looking at if we can get some Johnson & Johnson, which would be our preferred method of going door to door, so we don't have to repeat that schedule in 4 weeks or 3 weeks, depending on what it was. So we are exploring options to address our populations that can't get to the clinic, and we're building some lists and reaching out to some organizations that can provide us with the names and locations of these people, so that we can kind of methodically and in an organized manner go out into some neighborhoods and reach out to these people that aren't going to be able to come into our clinics. We're also working to identify large employer groups as we step into this open population phase that will help us to identify populations we can get a hold of. So stand for questions, but I'm going to call that the end of report for now.
Hi,
Thanks, Ken. So yeah, we'll go ahead and open it up for border staff questions for Ken, if anybody has any. I see Pam Boyd's got her hand up. Pam.
Ken, I have a question I hope that you can answer. I had a member of the public tell me that they had heard that the vaccines that were left at the end of the day's clinic, if people didn't show up for their scheduled appointments, were being thrown away. Could you tell me what's happening with those leftover doses?
So to date, I can tell you that we have not thrown a single dose away. At PHC, what we tried to avoid was having large crowds of people sitting outside of our clinics waiting for these extra doses, because it becomes kind of a crowd management sort of business. But at PHC, they would basically, if they had to pop a vial, then they had a few doses left, they would go outside and find some people who had heard that there may be extra doses, and they gave those shots to people. But the other clinics, we had a sort of a informal type of waiting list, and we would also, use those shots for individuals on our team, or people who were working in this vaccination clinics who could potentially be exposed to COVID, and that we thought identified as critical to our organization. But happily, I can say we have wasted no doses. So that's a false rumor.
Yeah, I figured it was, but thank you very much.
Okay, thanks, Pam. Ellen, I see you have your hand up.
I just would like the board and the members of the public participating in this meeting to, there really aren't the words to describe what an excellent approach this has been. And just seeing Ken step in at the last minute for Adrian and be able to answer any question and give us a good report on what's going on, I think is just indicative of what they've been doing since the moment they were charged with this task back in January. Missoula County, we get so many positive comments from the various the recipients of the vaccine, regardless of where they go to get it. And so all of our collaborating partners, we just all really feel part of the same team. And we currently have more infrastructure, much more infrastructure than we have vaccine. So I obviously, I can't find the words to tell you what a strength the vaccine coordination team has provided to Missoula County. And lots of accolades go to them.
Yeah,
Hey,
definitely.
thanks, Ellen. I'd like to just add to that, that what we do, really, we are a coordination team, and it's the people at the health department and at PHC and at the university. Those are the hardworking individuals that really make this happen. And Missoula County is just an amazing place to work, and to do this kind of effort in, and to see everybody come together. And so thanks, Ellen, but really, it's the people in Missoula that have made us successful and made us look good, and the professional individuals that we're surrounded with every day that go out there and day in and day out do their best work and do everything they can to provide a good product for the public. So right back at you, Ellen, that working with the health department has been a joy. So thanks, you guys.
All right. Thanks, Ellen and Ken. And Josh, I see you have your hand up.
Thanks a lot, Ross. So, Ken, I just wanted to echo some of this, and then I have a question in what otherwise would be a very deeply decentralized system where there's a high potential for people to be tripping over themselves. You guys have stepped in and provided much needed coordination, and instead this thing is just humming along. So really well done. I've had multiple really positive comments come to me via phone and email, and that's not typically what we get about anything at the commissioner's office. So thanks a lot. My question for you was, you mentioned informal waiting lists for people to access vaccines that are left over at the end of the day. What's the process there, given that we're in a public meeting right now and people will be tuning in? If somebody wants to get on one of these waiting lists, what do they do?
Okay, so generally, we're only talking about 4 to 5 doses. So this is not a public-facing waiting list, because it would just become unwieldy, and it really would be disappointing to anybody that wanted to get on it, because it's really not. Yeah, we're not talking about hardly any doses at all,
Great.
and that list tends to be built by the people that are the providers that are providing the product. They identify some people within their own organization that fit into the tier, but it really is only oftentimes in 0, but the most that we've ever seen has been up to maybe 5. So it's when I say list, it truly is not hardly anybody at all, and we tend to be very efficient in our delivery, and it results in very few people needing, or very few shots left over.
Great, thanks.
Great. Let's see, any other board or staff questions for Ken while we've got him here with us?
This is Pam again. I just wanted to reiterate what Ellen and Josh have said. Both the clinics are fantastic, and I can say that personally from having been through one to get the shot, and then I volunteered at Partnership on Monday to help, and it was just such an organized, wonderful process as somebody stepping in as a volunteer. You guys have done just outstanding work, so thank you very much.
Yeah, thanks, Pam. And well, I'll echo that as well. My wife and I were lucky enough to, actually there was one day where there was a waiting list that was advertised, I guess, on the health department's Facebook page, and we were able to get on that waiting list and get a shot, get our first doses out at Lucky's, and we were just both incredibly impressed by what a large operation it was, how smoothly it was running. There were it was a fairly busy day, and just the number of people that were moving through in just an extremely organized manner, and just the degree of volunteers and whatnot. And one of our own, a couple of our own board members have been volunteering out there quite a bit. I know Dan Cordy's been doing a lot of volunteering at the public sites, and Pam has been as well. And thanks to you, and thanks to all the volunteers, and thanks for the incredible organization. This seems to be running very well, so thanks to everyone involved. I am not seeing any other board or staff questions for Ken. So with that, thank you very much, Ken. Thanks for jumping in and doing such a great job filling in, and thanks to your team. And with that, we'll move on to item number 2, which is a COVID-19 briefing by Ellen.
Thank you. I will run through our indicators. Members of the COVID committee of the board that helped us prepare the proposal for today, we met earlier. And so they will have seen not these exact not the updated figures, but they will have seen the trends that we have, as well as we've added some new metrics related to vaccine. And of course, what we're trying to do is keep transmission rate low and push vaccine rate up. And I know that you'll hear me say that a few times, because neither one of those is a light switch, right? It's a transition. And so I will highlight those newer indicators because they do play a part in what we've proposed to you today. So finding the share button here. These indicators are from 2 days ago. There have not been major changes, so I did not change them again simply because they've already been posted publicly and we did not have major changes. So they are posted on MissoulaInfo.com every week. If you go into data and you go into data trends is where anyone who's interested will find the weekly trends as opposed to the daily indicators that we put up with case counts and hospitalizations and whatnot. So our epidemiological profile, we're looking either at, our goal is to descend Our goal is always to descend, if not to disappear, but and we did have a long period of descent. It was a good 6 weeks of descent, but we did see upticks in those, and some upticks were bigger than others. Each one was a little bit worrisome because you don't know if an uptick is going to go into a spike. And an uptick is like a small little spike with a disease with a 2-week incubation period. Anything you're looking at is a good week to perhaps 2 weeks old and can't really tell you exactly what's going on today. So we always want to look at trends. And we had been descending for those 6 weeks. And we finally got into what was the green zone using the traffic light model, green, yellow, red. And the last time I met with you, we were in the green zone because we had a constant descent. Then last week, when about the time I was meeting with the COVID committee, we started plateauing. We were plateauing at what is a relatively low level. And that was around 11. I think the lowest we went was 11. However, and I know the board's heard this a few times, but again, speaking for the public and the other interested parties who are online trying to help us get through this transition and also have a very important need to plan ahead for their business, their community, their services. So I want to go into it a little bit. Plateauing at a level that is still ripe for a quick transmission or an uptick or even a spike, even though that feels a lot better than it did last fall. Keep in mind that when we spiked, we were way, way above our goal of 25 on incidence. So it was great to have it come down, but when it plateaus, and it plateaus at a fairly high level, meaning it's still ripe for picking back up. It's like the embers didn't get put out well enough in your campfire. That becomes worrisome. Immediately after that, we did see an uptick in the last week that did relax back down. So compare, that put us back into the yellow. Watch and wait. So compared to the previous week, it is a bit worse. And then moving down to our chief goal that we had been in the whole community was focused on, and that was the Harvard Global Health Index for COVID-19, which strongly recommends staying at or below 25 incidents for at least 14 days, which equals the incubation period for this. And you might recall it took us, we were as high as 87 when we were really rolling along with the rest of the state and much of the nation. However, we, after that descent, as I mentioned, we got down as low as 11 and we started plateauing. And just like it says in the literature, once you start plateauing at too high of a level, you can spike or uptick. And we did. And we are landing at around 16, whereas we had been at 11. So with our goal being 25 over a 7-day period on average, we want to keep a close eye on this. Keep in mind, though, we're coming at it from the right side of the bar this time. Instead of being outside of the frame, we are within the frame, and we're trying not to bump up into that limit again or get over it, because we want to see more relaxation of restrictions. Nevertheless, we were, that is worse than when I talked with you last time and worse than it was last week. Our transmission rate during all of this that I've just described to you actually did stay below 1. And that means, if you're below 1 for your RT, you are slowing. And if you're above 1, you are growing. So we are still at slowing, but we've danced around with those little upticks between 0.8, 0.9, above 0.9. We just, knock on wood, haven't quite hit 1. So we still have a little bit of a yellow marker there. Our test positivity rate came down and stayed down. Now, part of that, we did have a big drop in testing, which is expected when fewer people have symptoms. We did open up to asymptomatic testing for screening purposes. We haven't gotten a lot of uptake on that. But our test positivity rate, we still have a good saturation of testing. At least over 49% of the Missoula County population has had at least one COVID test. We actually have a data system that can deduplicate for that on our data team. And our goal is to stay below 10. If we get above 10, it means we're not doing enough testing and we're actually we're missing some of the more minor cases. So we are in the green at testing. We're getting good turnaround. We do have to keep an eye on that, though, because some of the labs are starting to pull back on their weekend analysis. And that just disrupts the picture that you're seeing. When you're doing everything 7 days a week, the trends you're seeing are natural trends. But when you start pulling resources away, some of the trends are going to change, or the picture is going to change, because you actually didn't run the analysis and you batched it up for a few days. So we want to be careful of how we look at that. We have been looking at case doubling since we were spiking, and since we've been descending, case halving, meaning cutting in half. Case doubling, when we started looking at it, had a baseline of 22 days. We were doubling our cases. If in uncontrolled spread, such as kind of the exponentially pure spread that you can see, and we did see in this country to a large part in the early days of New York City, your cases, even with this disease and a 2-week incubation period, can double every 3 to 5 days. I mean, it's horrendous. So there's really not a goal for that. This is just to help us look at, wow, how bad are things getting? And so when we started watching doubling, we were at 22 days doubling, and we have since switched over to cases halving, cutting in half. So you want a high doubling rate and you want a low halving rate. And our halving rate just went up. It was hanging around 18 when we were plateauing, and then with the spike, it's gone up to 24. So again, we're just keeping an eye to make sure those spikes, which are a natural occurrence, because this disease spreads in a distributive, not a linear fashion. So spikes are just kind of scary. You got to watch them upticks. Make sure they don't persist. Okay, so we've added in the last month 2 indicators related to vaccination, because we want to not exceed certain dangerous transmission trends. At the same time, we want to push vaccinations up. And I think one thing Ken Parks didn't say to you, but that we say publicly quite a bit in our interviews, is Missoula County, because of the efforts and the cooperation that we have from so many partners and the coordination, we have much more capacity to give vaccines than we have vaccine, much more. They have numbers for that. They've sized it all out. So we're really held back only by those weekly vaccine deliveries. One of the indicators that the state of Montana, State Health Department, publishes every Monday on their website, and I'm not going to mess with the technology to put up the website, but those of you that are familiar with it, they publish the vaccine rate for the whole state every day. They publish or update the county level rates every Monday. So what I'm showing you here is this previous Monday's dose administration rate. And I'm going to focus on this for a minute because it's new to the public, and it is being proposed as one of our key metrics. So we've had 25 as our incidence rate to get below it and stay below it as our metric for months. We're keeping that out there. We're keeping that out there. There are other metrics to try to get lower, but as we move away from transmission metrics, we want to move toward vaccination metrics. That's the goal. So even though we have largely 2-dose immunizations out there. There are some 1 doses. We do want to look at that productivity every week. And we also know, based on the high efficacy of the particular vaccines that are in use, which are screamingly high efficacy rates, they're just beyond what we could have hoped for, that we are getting not only some personal level protection with 1 dose, the person is not considered safe, they still could be infected, they still could infect others at 1 dose. But we are getting likely some population level curbs on transmission because of that at least first dose efficacy. And we are also watching the second dose, but right now I'm looking more at the resource of how quickly we're getting it out there. So as of Monday, and we had some nice influx of vaccine, as Ken said, from PHC and the federal pharmacies last week. So that gave us more to work with. And our vaccine dose per 1,000 residents, and those residents are ages 16 and up, because no one below that age is eligible. So our denominator here is actually 99,813. It's not the full population. 444 doses per 1,000 people had been administered in Missoula County by last Monday. The prior week, just to give you some indication, because we look at this every week, but I know the board generally meets once a month, was 366. So it was a huge hike. And when we get into our proposals, we'll talk more about how useful this can be. Now, I've also noted that we are in what the state considers the second quartile for productivity. What does that mean? Well, the whole state, and the state is above average for the overall U.S. administration. So that's good. They every week look at where all the counties are, and they divide that from the lowest number to the top productivity into quartiles. And the top quartile has a higher dose rate. What's really neat is over the past 2 weeks, we have seen the counties with Indian reservations become the first quartile. So the uptake there, the administration, the access is just, and that population has, even though they make up only 7% of our total population, has, based on from county to county and overall, has seen as much as 17 to 27% of the deaths, the Native American population. So I'm not sad about being in the second quartile. I am happy because I know who's in the first quartile, and it really shows us what we can do. And then we have some large counties, and actually more smaller counties that are in the second quartile. So that's better. We were in the third quartile in the prior week. Okay, case investigation is an old indicator, and we are sized to do 90 new cases a day and to be able to start investigation in 24 hours. And we have cut staff, but we're hanging on to them just in case something goes awry. People letting off their caution too soon, or perhaps an infusion of variants, or hospital admits. The numbers are low enough now that they do go up and down quite a bit, and keeping in mind that we're a regional hospital. And in fact, in our region, in Missoula County, we have remained really low in comparison to the state transmission rates and case rates. But our hospitals don't always reflect that, because they of course get the diversions from the other hospitals. So those have gone down and they're better. Community mitigation indicators, how well are we doing with those? When we look at, the whole state is in a low area. Some counties are starting to pick up again, as we've been warned can happen. Our current incidence rate is 16 and the state's average is 40. So even at our spike, when we were all really high with high incidence rates on the 7-day average, that's for new cases, Missoula County did stay below the state average. So that's good, but the state's going up a little bit, and that can certainly affect us. Even though we have mask ordinances and others don't, we don't have a, we have a permeable boundary. We started looking at the total or cumulative incidence rate for our county compared to the state average, now that we have a year's worth of data. And this really, our performance here, and I mean that, our performance means the whole entire county performance, the residents, everyone. We have been 27% lower than the average state incidence rate. And we are holding that. And that's what we want to hold on to, because we don't want to get above that 25, get new cases and start spiking up. We are actually as much as 37% lower than some of the large counties, our peer counties. So what people did worked. If we can hang on to it for another 6 weeks to 2 months, we are really, really going to pull out. So that's very good. Our population that is fully vaxxed is 17%. That's low. That's why it's red. Herd immunity is estimated to need to be between 70 and 80%, but it's still good. And that is why we are not proposing this number at this point as a metric. I think we will be able to propose this number as an actionable metric for the board, but based on the good advice of Dr. Stenger, other members of the board, the epidemiology experts at U of M, our community leaders, and our Missoula Area Command, we're not using that as an actionable point yet. We are actually looking at the dose rate for the reasons given. So I want to leave with that, because when we go into the proposed actions for the board, this is what one of the things we're going to key off of. Are there any questions?
Okay, I'm not seeing any hands up. So with that, thank you, Ellen. And I believe we'll move on to item number 3 now, which is an action item. Since it is an action item, let me go over let me go over what we're going to do for public comment. We will have our next 2 items are action items. The first item is to review and revise Appendix A of the Board of Health. And then we'll move into item number 4, which is to review and possible approval of interview process and questions for our director candidates. So what we'll do is we'll have for item number 3, which is review and possible revision of Appendix A. After Ellen and Shannon and any other staff present that to us, I will open that up as a public comment section for that specific item. And we'll probably keep it at 3 minutes per comment with that. And then we'll move into any potential motions on that. So just anybody out there that is hoping to provide public comment, we will have public comment on that specific item number 3 after we're done discussing that specific item, but before a motion is put on the floor. So with that, I'll turn it over to Ellen and Shannon to go over item number 3.
Thank you. I'll just lead off from where I stopped. Again, we're in a transition. We want to keep the case numbers down while we're pushing the vaccine rate up. We expect to be bringing you more proposals for relaxation at the next regular board meeting, if not sooner, depending on what happens. That is all contingent on keeping the case rate and the incidence down and controlled, and the vaccine flowing in. So even though we can't fully predict how quickly the vaccine will flow in, we do know the experience of what happens if the transmission goes up, and that's very well evidence-based metrics. So what we're proposing is looking at the incidence rate. When we were above the incidence rate, where we shouldn't have all been, but we all were, it was a goal to reach it. Our goal now is to not go above it. And so that becomes a contingency. And then our goal that we reach for, so assuming we stay below that 25, and then what we're reaching for is how many doses we can get out there, because there's a point at which you can get enough doses out there where two things are happening. One, particularly since we have focused on the most vulnerable, those most likely to be hospitalized or actually die from this disease, even our low vaccination rate of 17% is very heavy with the most vulnerable folks being first. And I can't give you a metric for that right now. Lots of epidemiology work being done on that. But generally that 17%, even though it's low compared to herd immunity, is strong in terms of vulnerability for our residents. So we look at that productivity rate, that dose rate, for the reasons I mentioned, and I want to point out that Dr. Stenger was instrumental in this concept for our group as we were looking at what to propose. And again, keeping that dose rate going up, not only do you get individual protection, if not full protection with one dose, that high efficacy level for these particular vaccines does suggest that some population protection is also in there. So that's why we put that forward as the metric to watch, and we do think it will continue to increase. So we're focusing, we're introducing those metrics for now, and we're focusing only on Appendix A right now. And Appendix A is the events, gatherings, and those types of things. Why are we doing that? The main reason is that there are so many important, looked for events and gatherings that have been put off for the last year that could go forward without all the restrictions that we had before, if we can stay within those bounds that we've just described and continue to make vaccine progress. But all of those need a lot of planning. Many of them are nonprofits. Many of them ask for money up front. We have vendors and bands and all sorts of different people that we need to get on their itinerary. And to allow that to happen, we need more planning time. And we wanted to have planning time without, just doing light switch on and off with restrictions. So that is what we're proposing. I mean, that is our reason for bringing you these proposals today. And we have gotten a great deal of input and expect more at this meeting from the people who have special interests. They either plan those events or they want to go to them. And I don't mean to suggest that there are, these events are many people's livelihoods. Some of them are fun and they do contribute to nonprofit entities. But many of them, that is the livelihood. It might be the music or the concert industry or so they're very, very important for a number of reasons, and we wanted to give as much advanced planning time as we could and not be going day by day. So with that, I'll turn to Shannon for the proposals that you now have. And yes, we did make changes up to the last minute because we just keep advancing our thinking, and we're certainly hoping that any comments from board or participants can further improve it.
Great, thanks, Ellen. That's a good introduction. And so I will say that I think Ellen said this, but we did meet with the Health Board COVID Committee last week and talked about it as a concept, the concept of putting something forward so that the large events, all events really, would have some idea that something will be possible and maybe possible even in the pretty near future. Felt like that was important. And so as everything with COVID, things are coming together pretty quickly, and look for ways that we can improve it. So we, as Ellen said, the initial proposal included some key metrics, and it included like when the health officer, well, I should back up and just say the proposal, the initial proposal and the one we're going to present today has a kind of a different mechanism that we've used in the past here, and that is for the health board to set the structure and to set the key metrics, and then to have the health officer be the one who's evaluating that weekly and to kind of institute this new appendix when we reach those metric goals, so that it can be a little more agile, can happen in between a board meeting without calling the board together. So the board is setting the structure, and then the health officer is being charged with looking at the metrics every week. And specifically, we chose Tuesday of every week because Monday is when, as Ellen said earlier, one of those really important metrics comes out from the state. And so, but that's also early enough, hopefully, in the week to let people know what might be happening or what's possible on the weekend. I'm going to share my screen with you. Here we go. So that you can look at, as Ellen said, we have been making changes up to the last minute. And the reason we're doing that is that after talking with the board and putting this together, what we did is reached out to several different folks who plan large events in our community to get their feedback. And based on that feedback and some additional thinking from Ellen and from our environmental health compliance folks and the ones who review events, and from board members from the COVID committee, and actually other board members too, thank you, Dan, we felt like these changes would be good. And so some of this is, I just put some titles in to make it a little, and some formatting, so that's not a big deal. But one of the key changes here is that this case incident rate, based on a 7-day rolling average, instead of saying it hasn't exceeded 25 per 100,000 in the last 2 weeks, it's that it's not trending above, because we know that things can bounce around a little bit. And so we're asking the health officer to use her knowledge about what is happening with this disease to really look like, is this just a little bounce or are we starting to spike? And so obviously we don't want to open things up more if our cases are trending very strongly upward. And then the other thing that we needed to add is this. So there's kind of a trigger of when the alternative Appendix A would go into effect, and that's when we reach these two metrics. But we don't want to go on, off, on, off, on, off. And so once the health officer has issued an order, it still has to be reviewed. We still have to make sure that cases aren't trending upward or spiking. But again, we wanted to use this idea that it's a worrisome trend. The other thing is that this means that it doesn't have to automatically go back to the current Appendix A. And so there could be ways where we could meet in the middle, so that the large events that are planned can still go forward, but have to go forward with different mitigation measures. So wanted to leave that open because COVID is is not always, we can't always predict what we're going to see with it. But this allows us to make good decisions and, of course, always bringing it back to the board during their meetings as well. And then it goes into the event and gathering requirements and recommendations. So first thing is that it refers to the health board face covering rule. Face coverings are one of those very, very effective measures to keep down the spread of the disease. And so we wanted to tie this to the face covering rule and allow the health board to consider the face covering rule separately when you're ready to do that. And then here's the big change. Instead of having a lot of requirements of what events have to do to be very structured, which is what the requirement is right now for any events that are over those 100 or 250. Oh my gosh, those aren't even the right numbers, sorry. Over the numbers that we have in the rule right now. Instead of that, basically what we would be saying is we really strongly recommend that you follow some good best practices to control the spread of COVID-19. And so some of these, of course, these are recommendations, so they're not requirements. But those recommendations are to look at places where you really can take steps to mitigate crowding and areas and times of crowding. And one of the folks that I talked to is Matt Ellis from the Paddleheads, and he said that I could share this. I know that he's on the line as well. But an example of what that might look like is what the Paddleheads are thinking about, and that is that they're thinking of on their own capping attendance at the venue so that people can spread out. And so instead of 3,500 people, maybe have 2,500 people as the cap so that people have an opportunity to spread out in the seats. And also that would reduce some crowding at the food and drink stands. They are moving the entry gate to an area where it will be less of a funnel and more open so that there would be less crowding there, so that people would enter more into a bigger space and exit through a bigger space. And then they have ushers that can help, that they did this last year and can help people think about, you can move over, feel free to spread out so that, people are more spread out, talk to them about physical distancing. And then finally, they're thinking about ways that they could increase the opportunities for in-seat food and beverage service. And so all of those things are ways that would keep a whole bunch of people mixing and crowding at a venue. It's different than saying everybody has to stay 6 feet apart at all times, which is what really made it hard for these large events, venues, concert venues, to be able to meet the current requirements. Then the other pieces, of course, is to take steps to make sure sick people aren't there, and to clean and disinfect commonly touched surfaces throughout the event or gathering, and to provide ways for people to sanitize their hands or wash their hands. And then another change that we made from what we sent you earlier is that we realized that this statement was confusing. It confused us. It confused the people that I sent it to. So we decided that the best way to address this is to take out our proposal, which said that if you have over 1,000 attendees, and maybe I should change this to attendees, but if you will have over 1,000 attendees over the course of the event, that you have to contact the health department for information about how best to control the spread of COVID-19. Really, what we had been talking about, which didn't come through here, is that it would be a conversation about we want to be a resource if we can, and a place for them to bounce ideas off of, and for a place where we could share ideas. So Matt, we have used the paddleheads last summer, as an example over and over again about ways that you can spread people out and have large events, even during COVID, and really appreciated all the ideas and work that the paddleheads put into some of those gatherings. So we would be able to share that information. So we moved it. We also have the concern about what it means for our event reviewers to approve a plan when the only requirement really at this point would be a face covering requirement, and everything else is a recommendation. So it led to a lot of discussion here in environmental health compliance. So what we recommend to try to really get at what we're talking about, and I think that maybe I should make a few changes to this, but if the event will have over 1,000 people, and maybe we want to say attendees instead, that they would consult with the health department at least 10 days before the event to talk about how best to apply these control measures at both the face coverings and the other measures at their particular event. And specifically put in this concept of event or event series, the whole time when we've been reviewing events, if they take place at at the same venue and they really are the same thing over and over again, they just submit one plan. But we wanted to make that clear that, for instance, if Logjam Presents is having, 10 concerts at the gorgeous amphitheater out on the Blackfoot River, that they don't have to contact us each time, because they have this. We've talked about it with each other, and they have a plan for how to hold all of those similar events. And then, so that's where this particular change came from. And then there's some language in here that's pretty common. It's similar to what we have in our current Appendix A, which is that, hey, if things start going sideways, or rather trending upward, we may have to, the health officer may need to do something to scale back the event or to put on additional mitigation measures. And then the opportunity for a health officer to cancel an event if it doesn't adhere to the requirements of this rule or appendix. Right now, again, the only requirement is the mask of wearing face coverings. And then the acknowledgement that some of the venues have additional requirements based on the health board rule, which we do anticipate, as Ellen said, bringing some ideas about how to change those to your next meeting. So I will say that I sent a couple of comments to you, both from Nick Chakota at Logjam Presents and from the Missoula Downtown Partnership, who is in support of this. I did get an email from Donna Gockler. Donna, I don't know if you're on the call, saying that Parks and Rec appreciates the clarifications that they just reviewed and are in full support of it. And then Matt Ellis from the Paddleheads, who I know is on this call or is on this meeting, also said that I could say that they are in support of the at least the initial rule that I sent him to review. I don't know. He can speak to whether they support these changes, but I just really appreciate everybody looking at it and giving us feedback and being on this call to give public feedback, because what we want is something that works and that also helps to continue to reduce the spread of COVID-19. So it's all a balance, and that's what we're looking for. Okay, I think that's the end of my presentation.
All right. Well, thanks, Shannon. That was really good. And thanks for all your work on this and for all your work reaching out to the affected community members and taking their input. I think we you've done a great job of being flexible with this and adapting it to the concerns and the needs that you hear coming from the community. So with that, I'll open it up to board or staff questions for Shannon or Ellen. I see Dan Cordy's got your hand up. Dan, go ahead. Dan, I see you got your hand up. We're not hearing anything from you, so you've got the floor if you want it, Dan. All right, Ellen, I see you've got your hand up. Ellen, go ahead.
Yeah, I just want to add some emphasis for clarification to that new metric of how many doses per 1,000. And so that is that, that's in Appendix A. And the number that I don't think either one of us mentioned is the goal for that. The trigger goal would be 600 doses per 1,000. Just some clarification. Again, this is an individual dose of vaccine, regardless of whether the type of vaccine is a 2-dose vaccine or a 1-dose vaccine. Not counting that. It is an individual dose given that week. It could be the prime dose, it could be the booster dose, it could be a single dose vaccine. Does not matter for this metric. Per 1,000 residents, ages 16 and older. And we're reaching for 600. Why? That was the hard, we did do some projections on that over the weekend. And since we went from 366 2 weeks ago to 444 per 1,000 this last Monday, and we're seeing more federal come in, my projections, which I intended to be conservative. Actually, we're very conservative. And if people show up for the slots that are available, that's another topic as things start to slow down, but if people show up for the vaccine that is currently available, we can reach this metric no later than the 19th of April, if that's a Monday that week. Thank you.
All right. Thanks, Ellen. Josh, I see you got your hand up. Go ahead, Josh.
Thanks a lot, Ross. So, Shannon, this is great, and I appreciate the collaborative effort, and I think it looks really good. My question is, the health department now has kind of a dashboard of statistics up that people from the public can look at. Will there be a way to embed these metrics in there in a fairly prominent way? I'm using the metaphor of a scoreboard, so people could go to the website and really see where we are. Are we trending up? Are we trending down? Does it look like we're going to be able to have events or not?
So this is Ellen. They are already in there, Josh, but they're not. They're on the weekly key indicators, just as I showed you. However, a person would, they'd need to know where to get that, and there are people that track that. So if this is adopted today, I would talk with our public information officer about how we can move that up to the data homepage or in some place that it's much more prominent, just like we did with the 25 incidents.
That's great, Ellen. I really appreciate that. I think people will also, the public will really like that if it's right front and center and people can see, wow, I'm going to be able to go to this concert Friday or not. So,
yeah.
Thank you.
Great, thanks. Any other board or staff questions for Shannon or Ellen? Dr. Stengel.
Hey, Ross. This is Rob.
Yeah.
Not so much a question, but maybe just a comment, because I think there might be some issues that come up in the public comment. But first of all, I want to thank Ellen and Shannon for thinking through this and getting something on our agenda for us to look at and discuss today. And I think just a couple of things, in terms of the vaccination target and that, measure of 600 per 1,000. I think we're trying to pick a middle ground where we are not fully vaccinated, but that's the ballpark of 40 to 50% of the people in the county having at least one vaccination and some level of protection. And as Ellen said, we're really close to getting there. I think the other just couple of points I wanted to make are, one, we are flying a little bit blind in terms of like how to relax restrictions and what to relax as disease rates stay low and more people get vaccinated. And all of the guidance that we have, especially like the metrics from Harvard about the community incidence rate, were written in a time before we were vaccinating people. And so I appreciate that there might be some folks out there thinking, well, why don't we, we're not vaccinated, why don't we just open everything back up, and why are we still looking at these metrics that were sort of from the pre-vaccine times? And the answer is that we're kind of trying to adapt to this new reality on the fly. We had discussion in the subcommittee about which restrictions to think about relaxing first, and I think it made sense to all of us that to think about restrictions for community events that require a lot of planning made more sense than restrictions about masks, which it's really easy to plan an event for people that are wearing masks and for people to continue to wear a mask until we change that guidance. But for, especially these large events to think about planning, it made more sense if we're going to scale back one thing to scale back those first so that people can plan events. So I guess wanted to share those comments, and I think this is not the first time we're going to be talking about this as a board, and we may see going forward that even if we have those sort of spikes in disease rates that Ellen is talking about as still possible, with lots of people in our community protected, we may not see increases in hospitalizations or severe illness. And if that's the case, we might come back and say, we're willing to tolerate a little bit more low-level disease activity, but we just don't have enough experience with people being vaccinated yet here or anywhere else to really move away from looking at that incidence rate yet. But that may be the direction we're going over the next several months as we continue to roll out vaccine and see what happens with disease rates and whether people are getting severe illness when they are exposed. So those are all the things I was going to share.
Great. Thanks, Rob. Those are some, I thought that added quite a bit to the discussion. So thanks a lot, and thanks a lot for all the input you've had so far. And any other, I see Pam just raised her hand. Pam, do you have a question?
Yeah. So this is probably more pointed to Rob about the things that you have had discussions about, rather than this specific alteration in restriction. Have you talked about changing the restrictions for visitors to nursing homes in light of the fact that they now have, largely been vaccinated?
This is Ellen. I can respond to that. I will admit, a bit tardy in getting that blanket rule changed, but it did get changed yesterday.
Okay, great.
Yeah.
Okay.
Yeah.
All right. I've had several people ask me about it. So.
Right.
Okay, great. Thank you.
All right. Great. Thanks, Pam. Any other board or staff comments or questions on this subject? I'm not seeing any other hands up. So with that, we will I guess at that point, now I'll open it up for public comment. Actually, I see Dan Cordy just raised his hand. Dan, do you have a comment or question on the subject? I just heard something, Dan.
Can you hear me now?
I can hear you now, Dan.
I love technology. Sorry. This is a question for Shannon. Do you have any concerns about approving an event series and how new information when the health officer reviews stats on Tuesday will get to those folks if there are revisions that are necessary?
That's a great question. So I'll just say again that we won't be approving them. We will be, talking it through with them and giving recommendations and hopefully collaborate with them. But what I absolutely know is that it would go out as a health officer order, and it would be highly put out into the community and advertised in the community. But we would also have the ability to connect with those that we knew were having events, and that's something that we have been prepared to do and throughout this pandemic. So we do a fair amount of reaching out to people when things are changing, and we've done that, for instance, with the restaurants and bars. So I do feel like we could do that for those events that we know about. There will be a whole bunch of events that we don't know about, and so we would have to rely on public information. And the real hope is that we are not doing this prematurely, and that the disease incidence will stay low, and that we won't have to have those additional restrictions put on. We just, again, I think somebody said we're looking in a crystal ball, but it's really a cloudy crystal ball. And so we have to have those caveats, knowing that doing something like that for a very large planned event could be difficult. So.
Sounds good. Thank you.
All right. Thanks, Dan. Thanks, Shannon. I see Debbie, I see you got a hand up. Go ahead, Debbie.
It sounded like you were going to move to public comment, and I just wondered if you wanted to entertain a motion before you went to public comment, or if you just wanted to hear public comment on the discussion.
No, I had announced earlier that we were going to entertain public comment before the motion.
Thank you.
You bet. You bet. So with that, any other board or staff comments or questions? Seeing none, we'll go ahead and open it up for public comment. And Julie, I'm going to ask for your help to see if you have any idea how many public comment we might have out there, just for timing purposes. Okay. I see Matt Ellis has your hand up. Go ahead, Matt. And Matt, I'm going to ask you to try to limit it to 3 minutes, just so that everybody that has public comment has a chance to weigh in.
You got
go ahead.
Hope I'll be 30 seconds or less. First off, wanted to tell you all that we do approve the changes because we did approve it before the revision, and the revision looks great. Secondly, 2 quick thank yous. Number 1, thank you for thinking ahead and giving us time in advance of our event season so that we can plan. This really helps us be more efficient with our planning and more focused on the safety of our community with the direction you're giving us. So we appreciate that. And then secondly, we just want to thank you all. I know you don't hear it enough, but I think you guys have been fantastic throughout this whole pandemic, and we really appreciate all your work you've done to keep our community safe. Thank you.
All right. Thanks much, Matt. And with that, Nick Chakota, I see you're on with your hand up. Go ahead, Nick.
Yeah, I just echo what Matt just said. I mean, I think the health board, particularly Shannon's, done a great job of reaching out to all of those that are in the business of planning events. Obviously, this has been a pretty challenging year for all of us, but at least have the ability to look forward 3-4 months in our case from now and be able to see what we can do if certain metrics are achieved has been it's a huge help for us. I mean, we're trying to route bands and align up sound equipment, and each event requires months of planning. So it's helpful to have this kind of metric, and it's important. So thanks for that. And then we also voice our support for this amendment. I think it's very helpful.
All right, thanks much, Nick. And I see Ellen Buchanan's on the call with a hand up. Ellen, go ahead.
Not to be redundant, but I think the health department has been a rock star through this whole thing. You guys have my total admiration. Just two questions, actually. One, a clarification that the consultation with the health department for events that anticipate being over 1,000 people is a recommendation, not a requirement, which I found a little bit interesting. And then secondly, was there any discussion about capping size of events that would be considered? Because I don't see that in here anywhere. And as somebody who is getting emails almost daily and sweating bullets about River City Roots Festival, that may come into play.
All right, thanks, Ellen. And at the risk of getting in trouble with legal counsel, because I know these are supposed to be public comments and not question and answer sessions. I don't know, Shannon, do you want to take a crack at that?
Actually, I've sat through enough council meetings. Those answers can come later so that you don't break protocol.
Yes, I can answer if you want me to, or I can answer later if you want me to, Ross.
Go ahead, Shannon.
Okay. Ellen, you are right on both accounts. There is not a cap. So the idea is that it could be a very large event, and what we're asking is for those very large events to take into consideration ways to mitigate a lot of people crowding together, and the other things that are listed there. And then the other piece of that is the reason it's a recommendation instead of a requirement is, again, because all of the mitigation measures at this point would be recommendations. And so we really want to work with the people who are going to take our recommendations and are trying to figure out how to hold an event safely and to prevent the spread of COVID-19. But if somebody is just not interested, frankly, these are recommendations, and we don't know how that interaction would even go. They would say, we're not doing it. And we'd be like, well, here are the recommendations. And so we believe that the biggest events that are happening in our county will certainly talk with us because we have that sort of relationship with them. And the other thing that I can tell you is that we absolutely would reach out to events when we hear that they're happening and know that they're going to have over 1,000 attendees. We would reach out to them as well. We've done that in the past for sure, and we'll do that again.
Thank you.
All right, thanks, Shannon. And I see Emily Brock has a hand up. Go ahead, Emily.
Thanks. This is Emily Brock from the Missoula County Fairgrounds. We support the, what will be the motion, hopefully, and thank the health department for their work. As we move forward, we'll want some clarification about, or at least some the community effort in terms of clarification on masking outdoors. But of course, we plan on following all of the recommendations and consulting with the health department as we always do, and we'll continue to do that. Thanks.
All right, thanks, Emily. And I'm not seeing any more public comment out there. Julie, I'm going to ask your help to see if you're seeing any public comment that I have overlooked. Okay, I'm not hearing anything from Julie. So at this point, I think we're ready to entertain a motion.
Ross, you might have to ask anybody on the phone if they want to provide public comment, and then just to unmute, because I don't think they can raise their hands.
Oh, okay. Yeah, so anybody, and this is the part of the public comment process that Julie usually runs, so I'll probably fumble with it. Are there any phone callers that are on the phone that have public comment? If so, you'll have to unmute your phone. And I can't tell you how to unmute your phone because I don't know how. But anyways, if you are on the phone and a phone caller and have public comment, please unmute your phone and go ahead with a comment. And I'm not seeing any or hearing any. So with that, I think I'm not seeing any additional public comment. So with that, we are ready to entertain a motion if any board member so chooses.
Ross, this is Debbie. I would like to make a motion to recommend approval of revised Appendix A of the Board of Health COVID-19 mitigation COVID mitigation measures to allow the health officer to institute reduced requirements for events and gatherings if certain measures are met.
All right, thanks, Deb. Any board or staff discussion on the motion? Shannon, I see you have your hand up.
Yeah, so, this was written very quickly, and I would ask to be able to make one change or a small change here. So again, under event gathering requirements and recommendations, it says if the event will have over 1,000 people, if we could change that to over 1,000 attendees, it will read better.
Yeah, thanks, Shannon. And you had mentioned that when you were going through it. So Deb, would you?
Yeah, I accept that friendly amendment to the proposal.
All right.
Includes that.
All right. Thanks much. Any other board or staff comments or discussion on the motion? All right, seeing none, I think we're ready for a vote. We'll do a roll call vote, and I'll go around and ask each board member for their vote. Yes to approve and no to oppose. Dan?
Yes.
Great, thanks. Deb?
Yes.
Pam?
Yes.
Josh?
Yes.
Dr. Stenger?
Yes.
Great, thanks. And this is Ross, and I vote yes as well. Motion carries. Thanks, everyone. Great job. And as we've talked, we'll probably be doing these kinds of things more in the future.
Ross, you just muted yourself.
You're right. You're right. I meant to hit the camera. So anyways, thanks everybody. And as was discussed, we can probably expect to be doing this type of thing more frequently as we hopefully continue to get over the hump with the pandemic. And thanks to everyone, both board and staff and our community members and our business community. Thanks for everybody help, all pull in the same direction to get through this. We do a lot better job when we're all working together and understand each other's position, and just thank you to everybody. So with that, let's move on to item number 4, which is review and possible approval of proposed plan, schedule, and interview questions for interviewing the final 4 candidates for Director of Missoula City County Health Department and Missoula City County Health Officer. What we've got in front of us is a recruitment process that we approved at a prior board meeting, and that segues into our interview process for the final 4 interviews, final 4 candidates, I should say, which that process has the final 4 candidates being interviewed by 4 different community groups. One group being the Board of County Commissioners, a second group being the Missoula Mayor and City Council, and then a third community group comprised of members of the community, and then a fourth community group being basically the staff, health department staff. Those 4 interviews with the 4 community groups are set for next Tuesday and Wednesday. I believe we've got the county HR director, Karen Harrison, on the call and on the meeting with us. Let's turn it over to Karen at some point to kind of go into a little more detail on that. Then after the candidate interviews with the 4 community groups next week on Tuesday and Wednesday, the 4 candidates will then interview with the Board of Health, the full Board of Health, on Friday, March 26th. After all 4 candidates interview with the full Board of Health on next Friday, then we will have public comment on the 4 candidates and the hiring process. And then we will the Board of Health will go into a closed session next Friday afternoon to discuss all the 4 candidates and to rank the 4 candidates. And after the Board of Health, after we've got that ranking done, we will then reopen the meeting to present that ranking. So that's kind of an overview of the remainder of the process, the recruitment and hiring process. With that, I guess I'll turn it over to Karen Harrison, the county human resources director, to add anything to that. So Karen, if you would chime in.
Hi, this is Karen Harrison, the HR director, and Ross did a nice overview. What we also are doing while we organize, basically have 20 interviews going on next week, there is a liaison that's a county employee that will be assigned to each candidate and will participate in their assigned interviews. And after their 45-minute interview with each of those community groups, the candidate will be excused, and the liaison has questions arranged for each group to obtain feedback and summarize that feedback. And I'll have them submit all of that to me by no later than 9 a.m. Thursday morning, so that we can get that to the full Board of Health for their review and as part of their selection process on Friday, the 26th. And then, like you said, Ross, they'll go through that ranking process and see what you come up with, and then announce that to the public. Is there any more detail you'd like to go into that? I know we had some discussions this morning by email.
No, I guess the one thing that we should probably discuss, because it involves the full board, is how we want to do. Now, this is a discussion for the full board regarding the interviews with the final 4 candidates on Friday, the 26th. Do we as a full board want to have a list of questions that we ask to each candidate, or do we want to have it more free flowing? Like, I know the county commissioners and the mayor and city council want to, they've got control, if you will, over their own interview process, and whether they have a list of specific questions or just a conversation with each candidate, and that's up to to them how they proceed with that. Likewise, it's kind of up to us as the Board of Health how we want to handle those interviews a week from Friday. Do we want to have a list of specific questions, or do we want to have it more of an open conversation? Do we want to have a list of questions that we can fall back on to kind of guide a conversation? It's up to us as the board today to kind of figure out how we want to handle that. We had Karen Harrison pulled together a list of potential interview questions. And that's just kind of to kind of start this conversation now between us as a board. So with that, I think everybody on the board has received and seen these list of potential questions that Karen pulled together. But again, that's just kind of to get the conversation started between the board of how we want to handle our interview process a week from Friday. And so anyways, with that, I'll open it up to the board members to discuss that. I see Josh, your hand just popped up. So yeah. Josh, go ahead.
Thanks, Ross. I'm wondering if we should lean a little bit more towards customizing questions amongst ourselves for each candidate, because we'll have the benefit of reading what those liaisons write about each candidate. And so it might work out that the same set of questions for each candidate may not serve us well. If we read one set of things about one person and another set of things about another person, it might be good to have the opportunity to ask a question that addresses the specific things we learn about each candidate.
I think that makes a lot of sense, Josh, because as we know, I mean, 45 minutes sounds like a long time, but it can go away in a heartbeat. And each candidate is very unique and is going to bring a unique background and set of skills to the interview or to the potential job. And so, yeah, I can see where we might not get as much out of the interviews as we could if we just have the exact same set of questions that we ask everybody. So I think that's a good comment, Josh. Dr. Stanger, I see you've got your hand up.
I think I agree with Josh that we may have different questions about 4 different candidates based on the results of what happens with the different community groups. I just had a couple of process questions that may be directed at Karen. I don't know if this is the appropriate time to ask them.
Oh, go ahead.
I guess the first is, on our process, it talks about 3 finalists, and it appears that we have 4. So we might want to just...
Yeah, I made a typo in that. I'm so sorry.
That document. The 2, or I guess maybe 3 other questions I have, and I'll just throw them out and if you could respond to us. One is, if the liaisons for each candidate are different, that seems like a lot of power that person will have to sort of filter the information from each of the community groups depending on their own sort of personal impression of the candidate. So I wonder if you could comment on that. The second question is when we as a health board are going to get those liaison reports and how much time we're actually going to have to digest them before we have to interview candidates and think about what we want to ask them. And then the third question is just in terms of the group sort of C, I guess, on here, the community organizations. We've got a whole long list of community organizations, I think, to be as inclusive as possible in collecting feedback from the community. Are we going to know which community members and organizations participated in the groups for each candidate so that we know where the feedback is coming from? So those are my questions.
There are 4 candidates, and the liaison process, it's really difficult to have one person at every meeting and get this organized between 4 candidates over 2 days. But they are going to have specific questions to ask of each group. So the same questions will be asked per candidate per group. And I did say I wanted to have that to you by 9 a.m. on Thursday, but since the last interview ends at 3:30 on Wednesday, I think I can ask my liaisons to have those done by Wednesday and try to get them to you that night. So you have the evening and all day Thursday to review them. And it is a huge array of community members for that community member interview group, but not everyone is able to attend every interview because people just have their own schedules. So it's going to be hard to say who was at each meeting. And we're not going to really identify specific comments from specific persons. We just want to get kind of a summary of a feeling of responses, you know, positive or negative, or weaknesses or strengths, that kind of thing. It's just really difficult to get it down to a perfect science because of the nature of trying to get this out to as many people as possible.
That all makes sense. Thanks, Karen.
Yeah.
I guess I would want to maybe put in a plug, and I don't know if other board members agree, but I'd at least like to know which community groups are represented and how broad the representation is. I mean, I think it was our goal as a board to be really casting a broad net and getting feedback from lots of community members. And if only a handful of folks show up for those sessions, or, you know, maybe certain, you know, constituencies in our community aren't providing input, I think that would be good for us as a board to know as we're selecting that.
Yeah, I do have a list of the emails, and then a few more were added. I can at least get you a list. I think, you know, it's probably 40 to at least groups or people being invited. And we did have an outpouring of interest in response to the email. So I think people are excited about it, but we are representing a huge array, including the Gay Health Task Force, Empower Montana, which is Learn and BIPOC. We have Missoula Housing Authority, United Way, Poverello Center, University, the hospitals, public schools, rural schools, local community councils, who else? City Fire, Rural Fire, Missoula Aging Services, Open Aid Alliance, CSKT, and All Nations, Logjam, the Bar and Tavern Association representatives, trying to see who else. Is there anybody else you can think of right off the bat, Ross, that I might have missed?
Not off the hand. I mean, I'm just looking through the list that's already been pulled together on the recruitment process.
Oh, we've also invited some county planning people because they're involved with low income and moderate housing issues, environmental groups. So that's kind of the array of what we're inviting.
Yeah. All right.
Oh, and Dr. Stenger, if anybody comes to you and said, can I get invited, we can forward that meeting invite if it's somebody that, you know, is affected by the health department.
Okay. All right. Thanks, Karen, and thanks, Robert. Kind of bubbling out of this conversation, I'm going to throw out a proposal to the board. Perhaps we could, for these 4 interviews a week from Friday, perhaps each board member could come up with a specific question that they want to ask to each of the 4 candidates, and that can be a different question for each candidate. So the questions can be tailored to that particular candidate. We'd probably have, if we each came up with a question for each candidate, that would be 7 questions per candidate. We'd probably have time to get through that in the 45-minute interview. It might mean that not every board member got to ask every question that they wanted, but it would hopefully mean that each board member got to ask what they considered their most important question to each of those candidates. So anyway, just kind of throw that out there for discussion. And I see, Dan, I see you got your hand up. Go ahead.
I was going to offer a suggestion, but I like yours better.
I'm speechless.
Well, don't get used to it.
Well, thanks. Karen, I see you got your hand up.
Yeah, and I just commented, I wanted to let you know, you guys actually have a full hour because you're not going to have that liaison process.
Yeah, good point. Well, maybe we could each prepare 2 questions and then just let the conversation go as it proceeds. So in other words, maybe throw this up, kind of modify that a little bit for each board member to prepare 2 questions, but definitely kind of rank your number 1 question first and your number 2 question second, and we'd go through each board member's number 1 question, and then just see where the conversation goes, and whether it might be that the interview kind of it's going to be a bit organic. So if we may get to the second round of questions, or we may not, based on our time constraint. But with a full hour, there's a chance we might be able to get through the second set of questions for everybody. So, anyways, maybe throw that out there, with being that we actually have a full hour instead of just 45 minutes.
This is Karen Harrison again. I'm going to try to be at every single interview, but I can't be at all of them because some of them are double booked. But hopefully that's helpful if you have questions about what the liaisons write, because I'll also be attending your full board interviews in your closed session in case you have any questions or comments that you need to share.
Great, appreciate that. Just as a heads up, at our closed session, we'll have Karen will be attending that, as will Anna Conley. So we'll have legal counsel there, and we'll have HR director there. And Anna, I believe, volunteered to take notes and minutes at that closed session as well. So Anna, if I understood that wrong, now's your chance to.
They might not be as detailed as Julie Moore's, but I'll take them.
All right. Well, thanks for offering to do that, Anna. It's going to be an important thing, and it'll be nice for somebody other than one of us board members to be taking those notes and minutes. So anyways, back to the board. What do you all think of this process for our interviews next Friday? I guess I'll put Josh on the spot. Josh, what do you?
I like it. I think it was a great idea, Ross. I like that idea.
Well, it was your idea. I just tried to figure out a way to kind of put some sideboards on it.
Good. I think it's good.
All righty. I guess this is more of a question for Anna. I don't know if that detail of a process for our interview really needs to be committed to a vote or an action item. I see this as just being more of a discussion that we,
I think you guys have already approved protocol that encapsulates the general approach that you're talking about, and I agree with you. The details of who asks what questions don't need to be subsumed because you already have that action item of the general approach.
Yeah, no, thanks. And that's what I'm thinking, that, basically we're gonna, as a board, we're gonna go away, conclude this meeting eventually with the kind of task that we're each kind of tasked to come up with 2 questions for each of the candidates. But I don't see that bubbling up to an actual action item. So with that, do we even have an action item on number 4? I mean, we've already approved the recruitment process at a prior board meeting. So do we even have an action item? I guess I'd ask that to Anna and the board, if anybody's seen an actual action item that we have here today.
I think, as I recall, Ross, the purpose of getting this on today's agenda was just to make sure everybody was on the same page about the nuts and bolts, because it's pretty complicated with all the having to do it remotely and the public piece of it, but also the confidential personnel piece of it. So I think you guys are probably good to go from my perspective, from a public meeting perspective.
Yeah, I agree. I guess I was just thinking it was an action item because it was bolded on the agenda, and bolded items usually mean action, but I guess we'll just ignore that bolding then. Any other discussion or comments from the board or staff? Dr. Stenger, I see you've got your hand up.
Sorry to be long-winded. Just 2 more questions. One, are the finalists' names public yet? Or if not, do we know when that's going to happen? And the other question is there any mechanism for the general public, if they're not invited to that community forum, to provide input? Or would that be like attending our board meeting on the day that we're holding candidate interviews?
I'll speak to your second question first, Robert. And the public will have an additional public comment opportunity on that Friday, the 26th, after we've got a half hour scheduled for public comment immediately following the last of the 4 interviews. I believe that's like from 2 till 2:30, I think, is when that is scheduled for.
That's correct.
Okay. As far as your first question or comment, probably turn that over to Karen.
Yeah. Did all of you, the board members, get a copy of the schedule? Because yes. I can get that out to you guys.
I did.
Okay. And I'm also going to be, the candidates are very aware their names are public now. There will be a press release. I think Allison Franz is planning to get that out Monday. I will also be checking references of these candidates next week before Friday. And then if you do decide on a final candidate, that's when I like to actually talk to their direct supervisor they currently have. I don't like to do that to every candidate until we think we have a candidate in mind. And then we can always make any offer contingent on a successful reference in that regard. So I just wanted to let you know about that process going on behind the scenes.
All right, thanks, Karen. So just to reiterate, and correct me if I'm wrong, the 4 candidates are public.
Yes.
As of now, but there will be a formal press release on Monday.
Correct.
Okay, great.
And the last thing, did you guys, you should have gotten each resume. We took off their personal address just for their protection with each of your invites to the meeting on the 26th.
Okay, thank you. Julie Moore, I see you've got your hand up.
Yes, thank you, Ross. Are you able to hear me now?
Yeah.
Okay, earlier my mic wasn't working. I apologize. The question that I have is when you and Anna and Karen and I had a team session, we did talk and settled on how to do the minutes so that they could be very brief and so forth. But I neglected to ask, may I make arrangements with MCAT to live stream the open sessions to their Facebook and YouTube pages?
I don't know. I mean, what's our standard protocol? I mean, it's a public meeting, so.
Right. So they, for instance, are live streaming today's meeting to their Facebook and their YouTube pages. I just neglected to ask that previously, and wanted to make sure that we provide that opportunity for the public if it's acceptable, since this being an interview process, it is a little bit different from our usual norm.
Yeah, I mean, yeah, it is a little different. On the other hand, my understanding is we're trying to, and we're required to treat it as a public meeting like all of our public meetings. So I would think we would follow our standard protocols for our public meetings. Anna, do you have any input on that?
I agree with what you just said 100%, Ross.
Okay. All right. Does that clarify what you need clarified, Julie?
Yes, thank you. I did, in fact, already work with them to confirm they're available, and so I'll finalize the arrangement with them to do the live streaming next week.
All right. Thanks. Details. Thanks to everybody for all these details. I mean, there's a lot of details to consider, and so thank you to everybody that's thinking of the various details we need to address. Karen, I see you still have your hand up. Do you have something else you need to?
I just couldn't get my hand to go down. I don't know how.
Okay. All right. Yeah. Any other comments or discussion from the board or from staff? Okay, seeing none, and as we just clarified, this is not an action item, so we can consider that. We can consider item number 4 complete and then move on to item number 5 on the agenda, which is a legislative update that Mallory Scharf and Shannon are going to walk us through.
Perfect. Okay. Well, thanks for having me. My name is Mallory Scharf, and I am the Public Health Policy Specialist at the Health Department, hired on a temporary basis for the legislative session this year. And I hope you all have access to the memo that we put together about our work in the legislature so far. And I'm going to display just a few. Okay, hopefully that's displaying for you all.
Yeah, it's coming through.
Okay, perfect. So I'm just displaying information on a few bills that we're going to focus on today, which would affect the Board of Health and then Health Officer Authority. So the Health Department works with a few statewide public health groups to follow and engage with the legislature. And we kind of knew even before the session started that there would be proposed legislation to change sections of Title 50 that deal with the Board of Health and the health officer. And there was really a large field of bills introduced in this area, and that field has narrowed to just a few that you see there, as we are almost 2/3 of the way through the state legislative session. So 3 of the bills in this top section, House Bill 121, House Bill 269, and Senate Bill 108, all focus on kind of the same theme of transferring some decision-making authority from boards of health and health officers to elected officials in our governing bodies. And these bills really vary in how they would do that. So both in terms of which decisions would require involvement by elected officials in governing bodies, as well as the terms of the language used for this proposed process. So whether the board would make recommendations to elected officials, or whether the board would really adopt a regulation that would then need additional approval, for example. So there are also some specific proposals that board rules and health officer orders issued pursuant to an emergency would be subject to review by elected officials either right away or after a certain number of days. So with our work on this legislation, in addition to attempting to avoid really damaging impacts to public health and slowed processes, we have been looking out for how these process changes would affect our city-county health board, which of course has two governing bodies, the county commissioners and the city council. So it is still very unclear how some of the language in these bills will translate into processes that you all follow. And so if and when one of these bills passes through the legislature, there will likely need to be some work put into interpreting that bill and putting the changes into effect. It's likely that whatever change goes through will require some of your board actions to have additional review or approval by the county commissioners and the city council. So it seems very likely that one of those three bills will pass through the legislature, and we feel that House Bill 121 is the best of these bad bills. House Bill 121 is up for hearing in the second chamber tomorrow morning, actually. We have some major concerns about Senate Bill 108, which had a hearing last week in the second chamber and has not yet been voted on out of that committee. And I guess our concerns from Senate Bill 108 really are because it requires extra governing body approval for a large number of Board of Health actions, whereas House Bill 121 is kind of a bit more directed towards specific actions that would require that additional approval. House Bill 121 right now does include a very problematic change to the definitions of isolation and quarantine as they're defined in law. And so we are hopefully trying to change that with an amendment before that bill moves along too far. House Bill 269, the third bill in that kind of set, is really limited to affecting only Board of Health decisions that relate to wastewater regulations and fees. So it's even more of a finite change, and it would require governing body approval for those decisions. But really, the content of House Bill 269 is encompassed in Senate Bill 108 and House Bill 121 as well. So we are not really too concerned with House Bill 269. So the next bill that I kind of want to highlight for you all is House Bill 257, which is also listed there. And this bill may have a pretty broad impact on the ability to regulate private businesses. This bill prohibits counties, cities, boards of health, and health officers from adopting a resolution, an ordinance, a rule, or an order that would compel a business to deny a customer access to the business's premises or to the goods or services that business is selling. So you can kind of get the sense that that can be really broadly interpreted, and it's become pretty clear that this bill is in reaction to COVID face covering policies, but the unintended consequences of this bill could really be quite large. Of course, you all know there are many public health reasons why a business could potentially be ordered to temporarily close or to stop selling a product. If there's sewage backing up in a restaurant, or if there is food present that's associated with a foodborne illness. So there's just a lot of broad interpretation of the language in that bill that we're concerned about. The other dangerous piece of this bill is that it would apply retroactively, and so it may repeal some regulations that are currently in place. And House Bill 257 is up for hearing on Monday, this upcoming Monday, March 22nd at 8 a.m. So finally, a bill that is not about Board of Health or Health Officer Authority, but one that could potentially have some serious consequences for public health is Senate Bill 199. And as you can read there, the bill would legalize the production and sale of almost any kind of homemade food with no public health standards. The bill also legalizes the commercial sale of raw milk. And we already have a cottage food program in Montana that's been pretty successful, including in Missoula, which allows for the sale of certain types of homemade food that are less likely to cause foodborne illness. That program just requires a simple registration process, along with some requirements for labeling and whatnot. And Senate Bill 199 is just really far too broad. It places no restrictions on additives that can be added to homemade foods. It requires no labeling, even for common allergens. And then the raw milk portions of the bill don't really include standards for sanitation or testing of the milk or labeling. And that bill had its hearing in the House yesterday with committee votes on that. So aside from those very large legislative issues, we've also engaged with many other bills that are mentioned in the memo that was circulated out to the board. And so I'm happy to answer any questions you all have. And Shannon and Ellen have also been extremely engaged with the session, and they're on too if questions are better suited for them.
All right, thanks, Mallory. Shannon or Ellen, is there anything you wanted to add to this discussion?
Yeah, I would like to add a couple things. One, I cannot say enough how Mallory has helped not just Missoula County, but all of public health across the state during this legislative session. She is amazing. She writes incredible talking points. And when one of our lobbyists had to step down for a little bit because of a medical issue, she really stepped up and helped in an organizing role and communication role and has been amazing. One of the best decisions we ever made was to hire Mallory initially as a compliance specialist. So the second thing I want to add is I super appreciate the overview. We have a lot of angst in our organizations, the Montana Environmental Health Association, the Montana Public Health Association, and the Association of Montana Public Health Officials about the changes that are coming to Health Board Authority. And we are in a weird position of not opposing House Bill 121 anymore, although, so tomorrow actually serving as a informational witness instead of an opponent. But that is because the other bills that are still up there, especially Senate Bill 108, is just poised. It's poised to get to the governor's desk. Our lobbyists have done a lot of work with the sponsors of the bills. And in fact, House Bill 121 is a conglomeration of several bills that were working their way through the session, but also with the governor's office. And the governor's office has helped some of those bills go away. And so we're working very steadily with the governor's office about Senate Bill 108. I will say House Bill 257 is particularly incredibly damaging. Mallory said that. It's coming up for hearing next week. And at this point, I think we need kind of all hands on deck to try to kill that. And so we will send out a information to health board members about ways that you can message the committee. So that and the talking points about the bill, and then Mallory can answer any questions, so that they get a sense of just really how much further this goes than the mask rule. Not to mention the Missoula requiring face coverings and having an extraordinarily high compliance rate with face coverings is definitely, unquestionably, one of the reasons why we're 27% below the state average in cumulative cases. So that's that, I think, is what I just wanted to add.
So that was also, this is Ellen, so well stated. 121 does need to be the vehicle because there will be changes in transferring some, as the proponents call it, some accountability to elected officials. And so much work has been done to use that as the vehicle. So if we can get the the isolation language so that it matches the actual biological process, then that is the best vehicle. 257, I would just point out to cities and counties that it is so broadly worded and so open to interpretation that when you look at 257, you have to consider this is not just looking at health boards. So even if you're of the mind that, wow, we ought to change some things with health boards, this can reach into a completely undefined arena of city home powers. For example, it even mentions city business licenses, and it actually, those moments where everyone agrees that something has to be done by the government right away so that surfacing sewage is not in a restaurant. And our friends and our friends that come touring through Montana are in a safe hotel and a safe restaurant at that moment. It actually could tie hands in those very imminent demands and needs for action. So I won't repeat the others, what's been said, but just to underline those points that 121 needs to be the vehicle if something's going to go forward, and 257 and the other two are just, you can't even interpret. I think you'd finally be in front of a judge before you could interpret what those really do on the ground. So again, I want to thank Mallory, the whole group. It's our Missoula County lobbyist. Rebecca has actually also been a part-time, and I think more than part-time lobbyist for this effort that took 7 bills down to basically 3, with 1 in pretty good condition.
All right, thanks, Mallory, and thanks Shannon and Ellen as well. Any board or staff comments or questions on the legislative update? Seeing none, I guess we'll move on to item number 6, the director's report with Ellen.
Thank you. I don't have much to add except that I haven't determined, but I am working with HR and all the things that you have to look at when you're planning to retire. I had my first meeting actually on Friday, so just in time to start working on picking the final date in June. I had only told you June, so I've been watching your progress with the recruitment and now going through looking at all the other things like retirement, PERS, health insurance, you name it. It really was my first opportunity to even begin to think of those things was Friday. So as soon as I can get far enough along, I will send in writing the actual letter of retirement and resignation with the date in June. And other than that, I would like to, if there's if in fact the press release is going out from Allison about the recruitment, I would like to go ahead and see that gets forwarded to all staff, because I think it's just yet another, I know that they can tune into these meetings, but they're actually busy working, and I know that they did receive the all staff message a week or so ago about this upcoming process this week. But there's just a lot of staff, there's a lot going on, and I think the press release, for those that haven't been able to tune in some other way, could perhaps be a good way to make sure all staff do get that final opportunity, as decisions will, start to be being made next week and the week after. So I'm going to ask if there's any, unless there's objection from the board or anyone, I would ask that press release, whoever gets it forwards it to me if Allison doesn't, and I will ask Julie Moore to get it to her all-staff group. And that's the end of my report, unless there's objection to that suggestion.
Thanks, Ellen. That all sounds good and reasonable. Any other board members can chime in if they've wanted to discuss that at all. I'm not seeing any hands come up. And Ellen, just, I know we don't get, with these strange times with the pandemic, I know we don't get many chances to congratulate you both on the good work that you're doing with this pandemic, but also your incredible service that you've done all these years. And hopefully we'll have chance to do that down the road. Just kind of a odd times and a odd impersonal kind of way to deal with it at the present. So
thank you for that. That's fine. I think, it's everything we've looked at today shows how no one of us is doing anything alone or could do anything alone. And I think that's just a reflection of that. And I'm not going to count it done till I'm gone. I have, for my science background, I do still have some Irish superstition. So with that, I would love to project out that I'll take the pandemic with me. And actually, the worst part of it, I think we'll go. So if we all hang on a couple more months. Thank you very much. That's all I have for today.
Thanks, Ellen. With that, we'll move to item number 7, public comments on items not on the agenda. This is a time where the public can make comments on any items that were not on the agenda. So we're open for public comments on items not on the agenda. And I'm not seeing any comments out there. Julie, if you can see comments, let me know. But if not, we will move on to item number 8.
Ross, I don't see anything in the chat. Looks like we do still have 2 people in the session who've joined by phone. If the caller with last 4 digits 7199 has any comments, please state your name and spell it for the record and give your comment. We also have a caller, last 4 digits 2752. If you would like to give comment, please unmute your phone. And for either caller, if you're uncertain how to unmute your phone, try pressing *6.
All right, well, thanks, Julie. With that, we'll then move on to item number 8, which is any board or staff comments on items not on the agenda. Ellen, I see you got your hand up. Dan, I see you've got your hand up.
Just one thought on something sort of on the agenda, but I'm late. There's an opportunity for board members to observe the community session for interviews next week. Not necessarily with commissioner, city council, or health department staff, but the general community forum. That might be an opportunity for us to see a little bit more of the candidates.
Yeah, no, good comment. Karen, this is a question for Karen. Are the Board of County Commissioners interviews and the City Council interviews, do you know if those are open to the public or are those closed, do you know?
Ross, this is Julie. I believe Karen had to leave the session at 2:07.
Okay.
But I think Anna could probably answer that question.
Yeah.
Commissioner, anytime there's a quorum of the commission, it's a public meeting.
Okay. So.
That being said, Ross, I think the idea is that the public can observe that, but that there is not going to be enough time for the public to directly be asking questions. But I see Josh's hand is up, so if he has a different perspective on what that commission meeting looked like, he can chime in.
Thanks, Anna. So basically, it's what Anna said. Our meeting is public, so anybody can come and watch. We're not anticipating that we're going to have time at the end for public comment, but we might. Maybe it'll wrap up quickly. If we do, people can, but otherwise, they're welcome to tune in. And as to Dan's other question, my sense on the community meetings is that anyone can tune in, but the community members will be the ones who will be asking questions and having a dialogue with the finalists, but anybody can watch electronically.
All right.
And Ross, I couldn't get my mic open early enough when you called on me, so just an afterthought, primarily for the public, because I do get asked questions. I am not involved in this recruitment in any way, but I intend to be as available as possible with direction from the board after they do have a selection, a successful recruitment beyond the date as appropriate to help that person transition into the job in any way that I can possibly help after the selection. Thank you.
Great. Thank you, Ellen. And just to kind of reiterate on that, Ellen has not been involved in the recruitment process of the candidates at all. Ellen had some initial involvement back, I guess it would have been early fall or early to mid fall when we, the board, were just first starting to get our head around advertising for the position. I believe, if I recall correctly, Ellen helped us with basically job description and what kind of qualifications we would be looking for. And that was the last involvement that Ellen has had. After that, the board and the county HR carried it from there, and which, I mean, that all process would have started back in November, if I recall. So, anyways, just to reiterate on that the board has been basically operating very independently on this process, of course, with the help of county HR. But other than that, operating very independently since at least November. So anyways, with that, Dan, I see you still got your hand up. Do you have an additional comment?
No, just forgot to take my hand down. Sorry.
All righty. Any other board or staff comments on items not on the agenda? All right, seeing none, we will adjourn for the day. And with that, we're done. We'll see you all next week when the actual interviews start. So thank you, everybody.